I'm Ari Kugelmass, one of the co-chairs of the first ACC Asia Pacific International Conference in Shanghai, December 2017. So reflecting on the second full day of the Asia Pacific Conference, there were a number of highlights. I think the biggest thing we saw today was Dr. De Junbo describing for us the Chinese Cardiac Health Index. And this is really quite interestingly a very locally designed and tailored index, a variety of factors around cardiac health. What's important here is the word health as opposed to cardiac disease. And I think this will go a long way in allowing local governments and local public health agencies to target interventions that are specific to any given province and the people who live there. Beyond that, there were great sessions, everything from how to approach syncope to how to approach heart failure, contemporary questions and issues in acute coronary syndromes, to a wrap-up final meeting and discussion around cardiogenic shock, an area where we have a lot yet to do for our patients. But that's just what went on inside the large halls. I think what was perhaps even more successful over the course of the two-day conference was the simulation lab, where individual physicians got to actually go through a simulation strategy around different types of patient maladies and scenarios and get real-time feedback from ACC cardiologists. And then there was the issue of leadership training. There was leadership training on Friday, there was leadership training today, and we had a great session on Saturday night with Dr. Fuster, Dr. Krumholtz, and Dr. Ge talking about what it means to be a leader in cardiology, whether it's an institutional leader, a leader in research, or an editor. And I think it generated great discussion from the audience. And so that was probably the true highlight for me of the entire session. As the participants in this meeting go home and then go into their practices tomorrow, I hope they go away with two distinct new things. New knowledge as to how to treat a particular cardiac disease. But I think what really came out of this meeting between Dr. Fuster's plenary session and Dr. Ge's talk about the Cardiac Health Index is a new appreciation of how not to just to treat cardiac disease, but how to promote cardiac health in the communities in which we practice and the communities in which we live. This inaugural ACC Asia Pacific Conference has just been a resounding success from my perspective. Great participation, great registration, especially for a new meeting. But what was probably most noteworthy was the intense collaboration across the Pacific amongst the faculty, amongst the organizing committee, and amongst the staff, without whom any of this could have been accomplished.